This is the cadaveric specimen of a sheep larynx. This entire thing, this entire cartilage is the thyroid cartilage. Below the thyroid cartilage is the cricoid cartilage. This is the trachea and this is the esophagus. Now here is the imaginary hyoid bone which is not present in this specimen. Between that will be the thyrohyoid membrane. Here will be the infrahyoid muscles, the thyrohyoid muscle which we have removed from here. Here will be the cricothyroid membrane. Here will be the cricotracheal membrane followed by trachea. Okay. Now first of all we will see other major structures like this. This is the esophagus. As we can see from here, it has got a typical collapsed lumen. Unlike trachea, the trachea has got incomplete rings. As you can see over here, the posterior wall is membranous. Okay. This over here running in the tracheoesophageal groove is the recurrent laryngeal nerve. We will come back to this later on. This muscle over here is attached to the thyroid cartilage and it is going behind in the median raphe. So this is the thyropharyngeus. Similarly, the fibers coming from here are the cricopharyngeus. So this is the inferior constrictor muscle. The muscle over here is the cricothyroid muscle that helps in the tensor function of the vocal cords. Now, after removing the cricothyroid muscle, the muscle that we see over here is the lateral cricoarytenoid. It begins from the anterolateral lamina of the cricoid and gets attached to the arytenoid over here. As we can see, this over here is the arytenoid, this muscle. Okay. Now we will follow the recurrent laryngeal nerve. The recurrent laryngeal nerve over here is running in the tracheoesophageal groove right over here, and then right behind the cricothyroid joint over here, the cricoarytenoid joint, it enters the larynx. Here it is entering the larynx, and this muscle, as we saw earlier, is the lateral cricoarytenoid. This muscle over here is the posterior cricoarytenoid. As we can see, the muscle is attached to the cricoid, the posterior lamina of the cricoid, and the arytenoid. This is the muscular process of the arytenoid. This small transverse muscle that we are seeing over here is the interarytenoid muscle. This is the muscular process and the body of arytenoid. This is the interarytenoid muscle. Now here the recurrent laryngeal nerve has given a branch to the posterior cricoarytenoid, and then this is the small branch that it is giving to the lateral cricoarytenoid. Further, if we retract the thyroid cartilage, then we are able to see this muscle. This muscle is extending from the anterior part of the inner surface of the lamina of the thyroid to the epiglottis. Now the epiglottis here is absent, but this is the thyroepiglotticus part of the thyroarytenoid. We can also call it the thyroarytenoid muscle. Here it might be attaching somewhere to the arytenoid, but this is the thyroarytenoid. If we trace the recurrent laryngeal nerve, after giving branch to the lateral cricoarytenoid, it is going and giving and terminating with this branch in the thyroarytenoid muscle. Okay, now you may not be able to see in here, but here I am pressing the thyroarytenoid muscle, and the vocal cords that we see are getting compressed. Okay.